Today we're going to be discussing monkeypox, an older virus that's making a resurgence that's causing a little bit of concern. The concern being that monkeypox, for the most part, remained in the Democratic Republic of the Congo since its discovery. However, now it's appearing in areas of the world not typically associated with monkeypox. To be specific, the United States, Canada, Europe, and the United Kingdom. Monkeypox was first discovered in the late 50s by a group of researchers who found a colony of research monkeys in the Congo that had this viral illness. At first they thought it would not affect humans. However, that was wrong. Turns out that monkeypox is what we call a zoonotic infection. In other words, people become infected from the animal. Naming it the monkeypox really was a misnomer, because as an animal reservoir, the monkey is really not the number one culprit for passing it on to humans. It's really the rodent family. So we have tree squirrels, ground squirrels, chipmunks, and even the prairie dog. They also found out that it was a close relative of smallpox, however, significantly less fatal. Turns out that the monkeypox was an orthovirus of the Poxviridae family, which is just a fancy way of saying a virus that causes a pox. The fact that it's a close relative to smallpox meant that when you're looking at the clinical picture, it was almost indistinguishable from smallpox. It's not a big deal today because smallpox is eradicated, but look, on the right we have smallpox, on the left we have monkeypox. They're indistinguishable. So in the early days, you had to find out if the person was infected with chickenpox, smallpox, or monkeypox. The first human case came in 1970 when a 9-month-old girl in the Congo developed these pox lesions on her face. At first they thought it was smallpox. However, the smallpox vaccine had eradicated smallpox in her community. They later found out that it was monkeypox she was suffering from. Now let's jump to 1980. There were several hundred cases of monkeypox, mostly in the Congo. And if it was out of the Congo and you investigated that case, you found that there was some exposure to the Congo, be it a safari or a trip to the Congo or a trip to Africa. They went to some endemic community. But by 1980, smallpox was eradicated worldwide. The decision had to be made, do we continue the vaccine? Because they knew that the smallpox vaccine was protective against monkeypox. However, monkeypox had relatively few cases, was considered to be not particularly contagious, and also significantly less fatal than smallpox. So the decision was made to scrap the vaccine in 1980. Let's jump to 2003. 75 cases in the United States. The epidemiologists went and they found out that all but one had no exposure to the Congo. However, on closer investigation, they found that these people were exposed to a rodent pet that they purchased from a dealer that was importing illegal pets from the Congo. So they were importing animals that had monkeypox. And that accounted for the majority of those 75 cases in 2003. The interesting thing was, about 5 or 6 of those cases, when their throats were swabbed, they found out that these people had the monkeypox but were asymptomatic. The interesting thing was all of them were older, all of them got the smallpox vaccine. So that kind of sealed in the idea that the smallpox vaccine is protective against monkeypox. Transmission of monkeypox is twofold. First step is animal to human. Second step is human to human. It's very important to know how you became infected from the animal. If you came across an infected animal and started to pet it and managed to get some of its infected secretions onto your skin, those secretions containing the virus could get through little breaks in your skin, could get through the skin, or for the most part through your mucous membranes if you rub your eye, put your finger in your mouth. However, if the animal bites you, you get a much higher viral load. So a complex injury like that can get you significantly sicker than just petting the animal. After exposure, you have an incubation period between 7 and 14 days. Most people start to feel ill around day 12. You have a prodrome, where you start to feel tired, achy, backaches, significant headache. Then you start to go into an active phase, where you get lymphadenopathy, in other words, swelling of the lymph nodes, of the neck, of the axilla, of the groin, which is different than a lot of the other pox viruses. You don't get it with smallpox, you didn't get it with chickenpox. A fever greater than 101, associated with chills, which is typical of somebody who suddenly has a temperature that high, and a general feeling of lethargy. You're extremely tired. About 5 days after the fever, you start to develop a rash. There's a very specific rash. Usually starts on the face, but it could come anywhere on the body. The rash is a macular rash. In other words, it's reddened and flat. In a couple of days, it becomes a papular rash, which means you get little bumps in that rash. The papules then become vesicles, tiny little bumps filled with a clear fluid. And then those vesicles become pustules. These pustules vary in size, from a few millimeters to a full centimeter. These pustules are loaded with a thick yellow secretion that's teeming with virus. These pustules will burst. Once they burst, you're very contagious to people around you, which is now when we get the human-to-human spread. And these pustules, after they rupture, will dry up and eventually flake off. Unfortunately, they'll probably leave a little pock-like scar in the skin. Transmission occurs in a few ways. You could get the fluid from those pustules onto your skin, have it go through the skin, cracks in the skin, get in through mucous membranes, through the eyes and mouth. It could also be passed off through secretions during sexual intercourse. That's been a little bit of confusion right now because the majority of the Canadian cases were found in homosexual men. However, I doubt that this is going to become a disease of homosexuals, and I suspect that if you look at the cases in the United States, you're going to find a lot of heterosexual transmission during sexual intercourse as well. So I think that was just a red herring what's going on in Canada. The person who is now shedding the virus through the ruptured pustules can contaminate pillows, towels, bed sheets, and fomites. Fomites would be an inanimate object like a countertop or a doorknob, and you could get it from that. In fact, the virus lives on the surface for several days. Fortunately, monkeypox is not a respiratory disease. You can get some respiratory spread, but it would be difficult. Unlike COVID-19, where if someone coughed or sneezed, they spewed out a mist of infectious viral particles. With monkeypox, should you have a lesion in your mouth and you cough and sneeze, you're going to put out a much thicker, much heavier viral particle, and it's most likely going to fall to the floor. In fact, they're thinking that to get respiratory spread, you have to have very close contact face-to-face for greater than 3 hours. The risk of getting massive spread is considerably less than it was for COVID-19. So let's discuss how we diagnose monkeypox. Monkeypox turns out to be a double-stranded DNA virus. So doing a PCR test on it will establish the diagnosis of monkeypox. Now we'll discuss the treatment for monkeypox. Fortunately, most of the cases are going to be asymptomatic, especially if you've had the smallpox vaccine. But for the most part, within 14 days, the majority of the patients get well. The people who do get very sick tend to be the immunocompromised, people on chemotherapy, people who have had solid organ transplants, people who are getting stem cell therapy. Those are the ones that are at risk for severe disease. Fortunately, the antivirals that we use to treat smallpox also work on a monkeypox. That said, I don't think it's as bad as everyone thinks. I definitely don't think it's going to become another COVID-19 situation. It's an economy-crushing worldwide pandemic. I think it's something we're just going to have to keep an eye on and to be a little cautious personally when dealing with a wild animal or dealing with somebody who suddenly comes up with what they might think is chickenpox. It's also not the time to go out and start killing squirrels and rodents and groundhogs. The odds are, if you don't live in an endemic area, those animals are going to be just fine, and I wouldn't be concerned about getting monkeypox from them. So be well. I hope you learned something from this video, and have a great day.